Hi, I'm Caroline Dowd-Higgins, and welcome to a new episode of Thrive. I'm so excited to speak with Dr. Lisa Jerrells today, so come on in and join the conversation. Lisa, I'm so glad to see you. Thank you so much for inviting me into your beautiful practice, and I'm eager for you and I to dive into a juicy conversation. So we've known each other for a while now, but one of the things that struck me about you from the beginning is you talked about your responsibility as a doctor and how you really consider yourself a healer. Tell me more about that.
Yes, so I get to go to work every day and do what I feel like I was put on this earth to do, and that is take care of people and take care of patients. And so, you know, my philosophy in my practice is that I'm here to help each person in their journey, and so I have to meet each person where they are. And that's really my gift. So one person may already, for instance, be a vegetarian and they need help tweaking their diet, or someone may have heart disease or be smoking and they need help getting healthier. So I just meet the patient where they are in their journey.
And that's wonderfully comforting to the patient, right? That it's not a cookie cutter approach to medicine, that it's very customized, and I love the concept of a journey, right?
Yes.
Because it is a journey. It's not just a means to an end. Now, I'd love for our audience to learn a little bit about your journey, because as many doctors these days have done with their careers, you started in the corporate healthcare field in a very large practice, and then said, you know what, I'm ready to branch out on my own. Tell me that story.
Yeah. So I was in a multi-specialty group, about 40 physicians at the time. And I just felt like I was a hamster on a wheel, that I was trying to see as many patients as possible and move really quickly, and I was frustrated because I didn't feel like I could give the care that I wanted to give.
Right.
And so one day, actually, I was at our local farmer's market, and I was sitting on a bench, and I just had a moment where I decided that it didn't matter to me what the future held. I was scared to death, but I wanted to make some changes, and I wanted to make those changes for my patients. So I made up my mind that that's what I was going to do.
I love that that was this aha moment, and how cool that it was at the farmer's market. But that says a lot about you, right? That you could get quiet with yourself. I talk about this a lot as a career coach, that you could quiet that crazy, right, and say, okay, this is what I need. And I love that it was so clear.
Yes.
Was it scary?
Oh, yes.
Yeah?
I was terrified.
And I bet on some level it's still a little scary, right?
It is.
Being an entrepreneur and being out on your own.
It is. It is. Because there's no right answer, and there's nothing that says, oh, okay, you know, you're going to do this and you're going to be wildly successful. And so it's very scary. So you have to make a decision.
Right.
And as my friend Jean Scallon says, you make a decision and you go for it, and if it's not the right one, then you learn from it and you back up and,
you
and
fail
do it
forward.
again. You fail forward.
Yeah, and I love Jean, so that's fabulous
yes.
that you mentioned her. So let's talk about your practice and this fabulous name, Joie de Vivre, right? Which is the French joy of life. So how did you come to that? Because that's a departure, right, from mainstream medicine. You are the brilliant, unconventional doctor, and I love that about you. Tell me.
So first I want to tell my patients who can't pronounce it that it's okay to call it JDV.
There you go.
That's fine.
I like it.
So
Dr. J at JDV.
Dr. J at JDV. So I wanted a practice where really everything that we did behind closed doors with patients was about the patient achieving their joy of living. And when I explain that, that's really a new concept because it's not sickness care, it's wellness care and caring for the whole person.
Right.
So each person, you know, joy of living is different for every person. And so for someone that maybe, you know, we're diagnosing their cancer, or for someone that maybe how do we manage stress, or how do we help them with their appearance so that they're feeling self-confident in the workplace and feeling like they can move forward in their life.
Do you leave work every day thinking, gosh, I helped someone live a better life?
Yes, I do.
That's
the best part of what I do.
What a gift. And I so appreciate that you are proactive, not reactive. You know, I think we as humans have a responsibility to honor our bodies, and you teach us how to do that.
Yes. So I do a lot of teaching with my patients. So I talk a lot about stress management and about their diet and about how to decompress and actually how to treat minor illnesses with natural approaches. So we do that with vitamins and minerals and herbal therapies where appropriate. But certainly if someone is really ill, again, I want to emphasize that I have the training to address that. But I really love to do wellness care.
So it's a holistic approach, right?
Absolutely.
And unique based on whatever the scenario is. Okay, so let's cut to the chase though, because I love how you mentioned stress relief. So what's your special sauce? What do you do? Because you work hard, you know, and you're sustaining your own practice, and there's no safety net. It's all about you. So what is your special thing that you do to honor yourself?
So every day I try really hard to have at least 5 minutes of downtime and do that by connecting with nature. That's really my piece that helps me go through every day.
Rain or shine.
Rain
you
or
get
shine.
Out there.
Yeah, even if it's snowing, I try to go outside because I need that fills up my cup, and I've learned through the years how to help myself so I can help my patients too.
Good for you. Oh, that's fantastic. Okay, so let's dive in. You're a businesswoman, right? So obviously you are a credentialed medical professional, you're a doctor, but now you are a businesswoman, an entrepreneur, a marketing professional, a social media maven, right? I mean, you're doing it all, right? You've got to be an accountant, and I get you have other professionals that help you, but you've got to have the wherewithal to do all this. So how did you pull all that together?
Well, it's stressful sometimes. So what I really try to do is allow professionals to help me where they have expertise that I do not. But really, I hope at the end of the day that I get more patients by word of mouth and by referrals, that I take care of the patient really well while they're here. And I will say that I want to say actually that it's been very difficult because I started my business in at the end of 2008, and that's when the economy crashed. And so it's been a very difficult 6 years to keep going, and so we've had to be really innovative and figure out what the patients need as customers, like how they want to be treated. And so that's really an important focus. That's
They've got so many choices.
Exactly.
Yeah. So what distinguishes you, and let me be more specific, I love the word innovation, right? And I believe that you are a disruptive innovator in a good way, right? So you've done things so differently that it has attracted people to come to your practice, and you have this wonderful ability to give them time and really listen to them. But you've had to be a great marketer as well, so share some of your tips.
Okay, so so internal marketing is the best, really, but I've had to, as a physician, you know, in medical school you don't learn, well, you might have to have a billboard or have a social media person or use the internet or have Facebook presence. And so with what I do, trying to get the word out and being innovative, I've had to use those avenues to capture patients. And so recently, well, actually my most recent success has been with social media and with Facebook.
Yeah, you're nailing it, and I love it because you're just putting wonderful bits of content that's useful out there into the world, and I think it shares your expertise with people who are not in the office at the time.
Well, I think media these days is about education. So you have to teach someone something so that they want to come back and learn. And so that's really, and that's what we do here is teach patients.
Do you think it's fair to say that patients have to be an active partner with their doctor? So it's not just do this, they've got to ask questions, they've got to communicate.
Absolutely, and I encourage that. And that's not typical in a lot of practices because I want the patient to be an active participant. Because they'll leave here, my office, and then they'll go home, and then they'll be making their decisions and making their choices, and they have to incorporate what I'm asking them to do. So I ask patients to actually make a list of questions before they come to the office so they don't forget to ask me what's important to them.
That's fantastic. Love that. Thank you. Okay, so some wonderful things are happening in your personal life. You're newly married.
Oh,
Congratulations.
Thank
You've got
you.
the bride's glow.
Thank you.
And it was a destination wedding.
Yes.
So how exciting. How's your life? How has it changed?
It's busy.
Yeah.
So we have a combined family of actually 4 total children. One's grown, so there's 3 at the house, and so it's constant activity, and I love it.
Good for you. Good for you. So let's talk about being a working mom. I think the hardest job in the world, right?
Oh,
and
absolutely.
I know so many of our listeners are working moms, perhaps even working dads. So what's your advice? You know, how do you honor the kids and also spend time with yourself and your fabulous new husband?
So I would just want to say to listeners out there, especially women, it's not perfect, and you're going to screw something up. So it's okay. So just breathe, and I think as much as you can, if you're at work, you try to focus on work, and then when you're at home with your kids and your family, really try to focus on what they're doing. And I kind of have a unique approach. I don't know, I haven't asked the kids what they think about it, but I believe in home-cooked meals.
Yeah,
so,
and you're a great cook, so they must really benefit from that.
So I spend a lot of time in the kitchen, but I ask the kids, to come while I'm making dinner and tell me about their day, and then we try to do family meals as best we can. So
that's great.
That's a way for us to connect with the kids.
And that's so rare anymore to have family meals. I think that's such a special time. I fondly remember that growing up, as a young girl, and I think in this culture, in this day and age, that's rare. So cheers to you.
Well,
I'm
thank you.
sure your kids really appreciate that, besides your fabulous cooking. Good stuff. So what's the hardest part? You were so successful and you're such a great role model, but you know that I feel strongly about helping others learn from what was difficult for you. So what's the hardest part of being an entrepreneur, being a physician, running your own practice, raising teenagers, right?
I think it took me a long time to learn self-care. I would preach that to my patients.
From a doctor, right?
Yeah. But I think, especially in the last 6 years being in my own practice, I've realized that I have to take care of myself, or I will be unable to take care of others. So I do like I said, I enjoy cooking, so I try to do that a lot. And then I go outside and I exercise, and those things I really enjoy.
That's great.
And sometimes I need quiet time, and that's because I'm so on all the time. And I think that's really important for all of us.
Good for you.
To manage that stress cortisol hormone. So downtime is really important.
Do you ever find that in the middle of a work day you say, okay, now I need a little break, right?
Oh,
and
yes.
maybe you go out and take a walk, right, around the complex.
Yeah, or just shut the door.
I love it.
I just shut the door.
Shut the door.
But I just need a 2-minute break, and then I'll be back.
Exactly. I'll be right there. So what about the joy factor? I firmly believe that we have a lot of control over our happiness on a day-to-day basis, and you're such a joyful person. It just radiates from you. Your energy is palpable. So what does success look like for you, and how do you tap that joy?
So, actually, I suppose there's a book I would refer to recently that I read. It's called Love Does by Bob Goff.
Nice.
And I've realized about myself that I fill up my cup by giving to others, and by doing the things I do, I try to do it with love.
Nice.
And that's at times that's challenging, and at times that's stressful because I have a lot of demands.
Yeah.
But I really try at every moment to monitor what I'm doing and do it with the right intentions. And so that really helps me.
I love that word intentions, Lisa, because I think if we can be more present and be more mindful and more aware, we also have a lot more control and a lot more power. So thank you for using that word. I think it's fantastic. So, okay, let's be real. A lot of the women listening are stressed, right? The men too, but most of our demographic is focused on women. and they're saying, okay, great, that's wonderful advice, but what about me, right? I'm working late, and I'm raising kids, and I'm stressed, and I'm trying to find time for myself and my partner, but how do I really make it happen? So any other realistic work-life integration tips, especially for the stress, because you think about that physiologically, if that's right, from a medical standpoint, as well as emotionally and psychologically, right?
Sure. Well, I think in today's busy world, it's extremely difficult.
Yeah.
And I see it every day. I think that if we can exercise, or even just take a 5-minute walk, or just carve out 5 to 10 minutes daily for just quiet and getting perhaps some exercise, that's helpful. But it's very, very challenging.
And is it fair to say, again, I'm going to ask Dr. J, because I'm here, I feel very fortunate. Is it fair to say that even a little bit of exercise here or there is beneficial? Because I know people that I know say, gosh, I don't have time to go to the class, or I don't have time to spend an hour a day.
Oh, sure. You just have to.
Little bits count, right?
Oh, absolutely. You just have to decrease your cortisol level, and that's done by breathing and being aware of your breathing, and that can be done even just sitting at your desk, or really can be done anywhere. So you don't have to go to the gym. You don't.
So give up the guilt, right?
Give up the
Baby
guilt.
steps.
There's no room for guilt. We don't have time for that.
Dr. Lisa Jerrells, give up the guilt. Thank you.
Oh, you're welcome.
I think that's so important, and I think as women, we tend to beat ourselves up. I don't know why, but
it's genetic,
we're
I
prone
think.
to guilt than men. Gentlemen, we love you, but we do guilt better. That's not a good thing. So, one of the things that I would love to talk about is the art of self-confidence. And in addition to the medical practice, you have this wonderful spa that complements Joie de Vivre, and you offer a variety of resources and offerings, and I would love for you to tell us a little bit about that. And then I want to drill down to what makes a woman feel self-confident about how she looks. So tell us about the practice.
Okay, so I have both the medical practice and the medical spa, as you mentioned, and so when I start with a patient at the spa, my question to them is, what is bothering you about your appearance? What would you like to change? And so we start there, and we have lots of options. We can be pretty invasive. I mean, we do Botox, which is a nerve toxin, and we can give hyaluronic acid injections and change the face. Or if the patient would rather be more natural, we can just do basic skin care and do some things that will improve their appearance without being invasive. So self-confidence, that's a tough one, because it's multifaceted.
Yeah, it really is. It goes so much deeper than just what we look like, and again, I think it is different for women, right? We look at the gentleman with the salt and pepper hair, and we say, isn't he sexy, right? And a woman has a different aging process, at least in this culture. Do you see a shift in women who take advantage of these wonderful opportunities at the medical spa? Do you see a change in their confidence and how they carry themselves?
Oh, sure. They come back and report, things are going well at work, or they're feeling like they're in a place in their life where they can make steps forward, and that's really exciting to see that.
Yeah, that's got to make you feel good.
Yeah, definitely.
Okay, so again, harkening back to your daughters, is there something you would share with them about self-confidence? I mean, they're young, right? But knowing the journey that's ahead of them, any thoughts about that?
So it's important to not compare themselves to others and make their own path and be true to themselves, and the beauty will come from that.
Absolutely. Well, thank you for that. That's incredible. So let's talk a little bit about you breaking the mold. As I said, I see you as a wonderful disruptive innovator, and again, I honor that term as something that's really great. And as I said, you don't have a safety net, right? This is all about you and what you're doing in the world, and you've got this responsibility to grow your patient pipeline. So what are you doing that's disruptive and that's innovative and that's different?
I think really this concept of whole person care is just totally different, and taking care of the whole patient. And the other thing that's difficult is that I look at the patient as a customer.
Right. Right.
And in medical school, certainly you're not taught that piece of it at all. You know, there's
Really?
no business perspective.
Which is fascinating. You
Yeah,
know?
right. It's the patient as a customer. So
Yeah.
you want to treat them with respect, and you want to answer their questions, and you want them to leave feeling better about themselves than when they
Right.
came in the door.
Right.
So, and that's really a different concept in healthcare, because that's not normally associated with healthcare.
Do you think that's going to change? Because clearly
I
our
think it's-
healthcare world is changing by the minute.
Absolutely, absolutely. And the baby boomers are at the head of that
Yeah.
change.
Right.
So they're wanting to age gracefully, and they're wanting to age and not feel miserable as they
Right.
go. And so
Right.
they're looking for life enhancement things that from a medical perspective.
Right.
And so, I want to tell you, I did do an age management course
Ooh,
in
neat. Tell me about it.
Las Vegas with the program was called Cenogenics.
Cenogenics. Neat.
So the idea is that we have control by what we eat and put into our bodies, and the type of exercise we do in terms of cell aging. So that directly affects the aging cell. And so we have things that we can do that we can see from blood work, for instance, that can change the fate of the cell.
Wow.
So that's really exciting.
We have so much more
Yeah.
control, right?
Oh,
I
absolutely.
think-
Much more, I think, than we give ourselves credit for.
Wow.
Yeah.
So this is cutting edge technology that you
Oh,
are
absolutely.
using.
Absolutely.
Wow. So what are your biggest challenges?
Biggest
Tell it like it
challenges.
is.
Well, really, truly, it's stress management for me too.
Yeah.
I'm in the same boat as everyone else. I
Yeah.
have all these
You're living it.
stressors. I'm living it every day, and so my biggest challenge is stress management.
Okay.
I will say, what we put into our mouths allows us to either deal with that stress well or not, and allows us to feel good or not. And so, good nutrition is at the heart of stress management.
And really, you share this wonderful knowledge and wisdom. You teach your patients, which I love, right? So it's a hybrid role of being the physician, the healer, the teacher, because you've got to look at it holistically.
Absolutely.
So Lisa, there are so many entrepreneurs listening who are thinking, gosh, I would love to hang my shingle to sell my wares or, put my services out into the world. What's your bit of advice for them? That they're at that moment and they're thinking, should I do it?
Well, if it's truly their passion and their heart's in the right place and they want to do it, whatever thing it is, and it will help others, then they should just go for it. And it will work out.
So trust.
Trust.
Yeah.
Have to have faith that everything will work out for the best.
You're also incredibly values driven, right? You know what is meaningful to you, you know what's important to you, and that is palpable in this practice. So I applaud you for being so self-aware and for building this medical practice and medical spa on your values.
Well, thank you.
I wish you great success.
Thank you. Thank you.
So quickie, what's new? What's coming down the pike? Anything new and exciting?
Well, a couple of things. So, you mean at the spa or just?
Or personally,
or-
whatever you want to share.
So, we are doing some really cool procedures that grow collagen in the skin, and we're on the cutting edge of that. And so, we do things like the vampire facial and
The vampire
they do
facial.
that.
Tell me more.
So they do this a lot in California.
Yeah.
So we draw the patient's blood and we process the blood so that we have proteins that are in liquid form. It's like liquid gold. And then we put that on the face, and then we do what's called skin pen, and it injects those proteins into the skin, and the patient actually allows the patient's skin to start generating collagen.
That's incredible.
So it's really exciting. Yeah.
Fountain of Youth with
Yeah.
vampire.
The vampire facial.
That's really neat.
And then we're actually at Joie de Vivre. I'm developing protocols for treatment of diseases with herbal treatments. So I'm very excited about that because we don't always have to rely on the pharmaceutical industry, and I think there's more and more demand for that.
That's great.
And I think as the other thing I want to say is that as medicine evolves, I think genomics and genetics and the effects of the environment on genes is going to be really what's up and coming. I think right now that is not an affordable option because it's more research based. But I think as we go down these next couple of years, it's going to be really exciting to see what's coming.
And you're on the cutting edge.
Well, thank you.
Good stuff. Dr. Lisa Jerrells, I thank you
Thank
so
you
much.
so much for having me.
What a joy, joie de vivre to have you today. I really appreciate your time.
Thank you, Caroline.